So Maine Family Planning is trying to plan for the organization's future in spite of a recent decision that could cut the nonprofit healthcare group's patient pool in half. As Pearl Small reports, what they do from here on out could have widespread impacts.
We're talking about devastating impacts not only for individual patient health, but for public health as a whole here in the state of Maine.
As Maine Family Planning's 18 clinics prepare for major changes, Advocacy Director Olivia Pennington says the state needs to prepare for the consequences.
We're talking about people not being able to use their insurance, MaineCare, to access life-saving health care like cervical cancer screenings, birth control methods, STI testing and treatment.
Pennington says about 50% of their patients have MaineCare for insurance. But a federal judge for the District of Maine ruled Monday that the Trump administration is allowed to cut that coverage.
And those who are going to be hardest hit are the most vulnerable Mainers and those who need the most access to health care.
The judge's reasoning revolved around the big, beautiful bill passed by Congress this summer. The bill has language which allows Medicaid funding to be withdrawn from providers that primarily engage in family planning services and provide abortions. But as Pennington has said, the clinic is responsible for a lot more than abortions. And she claims for the majority of patients, Maine Family Planning is their first and only healthcare provider.
Without access to Maine Family Planning clinics, patients are likely to turn to their hospital systems, which are already overwhelmed. We are seeing hospital closures across the state, and our healthcare infrastructure is going to crumble.
For now, Pennington says the organization is continuing to treat many patients for free rather than turn them away, but that model is unsustainable.
That without the ability to bill Medicaid, Maine Family Planning may be forced to make the difficult decision to close clinics across the state. Only time will tell how many clinics will be impacted.
And how that impact could affect the state's healthcare as a whole is also something time will tell. In Lewiston, Pearl Small, News Center, Maine.